The task force in their statement suggested that the biennial screening will not affect insurance coverage. Does that seem to be an accurate statement, or is there any kind of gray line there?
Yeah, I think it's a gray line. I think that insurance carriers would certainly rather, on the surface, pay for an every 2-year screening. But if in the aggregate they wind up paying for the treatment of breast cancers that are more advanced, this will be a penny-wise and dollar-foolish decision. So I think that remains to be seen. I believe that we are in a legal period of moratorium. I don't think that these guidelines can be implemented overnight, and I believe that there's a vetting period that we're in right now. And hopefully cooler, calmer, smarter minds will prevail in this, because really these guidelines are an assault on women, they're an affront to women, and they're an affront to our common sense as a nation. The argument has been mammograms lead to anxiety. I don't think we're giving women the credit they deserve. Women are a lot better at handling anxiety than men are, I can tell you that. Or that it might lead to some unnecessary biopsies. Definitely true. But for women who have an early breast cancer, it's life-saving. And most women, and studies have been done to document this, women are willing to put up with a certain number of false alarms to save a life. And I think these guidelines ignore what women really value and what their priorities are and what we as a nation should do to protect ourselves. We're not talking about the expense of seat belts or the expense of other safety things, putting helmets on kids who ride bicycles, right? We're not talking about that. We're talking about a life-saving screening to detect a disease that 1 in 10 American women are likely to get.